Alright guys, I want to do a real quick video talking to you about the benefits of our cancer screenings. In other words, there's going to be two questions. Why should I get a cancer screening if I've already had cancer? What's in it for me? What's in it for my family? Let's start with you. Let's start with the person that has actually had cancer that you're getting ready to screen. Why should they get a cancer screening if they've already had cancer? That's a great question. Here's the answer. Cancer spreads. So if cancer spreads and your body is predisposed to cancers, and that's what our cancer screening does. It checks the genetic makeup to determine if the patient is predisposed to cancer. So if a woman has had breast cancer, for example, and the screening comes back and shows that she's predisposed to ovarian cancer, then the odds of that breast cancer spreading to her ovaries are a lot higher than if she didn't have cancer in the first place. So the personal benefit could be, it could help save her life, the patient's life, because we can catch cancer before it spreads. Okay, that's one benefit. Okay, that's a benefit specifically for the patient that we're going to screen. The second benefit, which is typically the more important benefit to most of our patients, because most of our patients are older, they say, I don't care if I don't want to know if I got cancer. Well, it's not about you, sir or ma'am. It's about your family. Because if we find that the cancer that you had in your body is of the hereditary nature, in other words, it's in your genes, then it's a good chance that could be in the genes of your children. Traditional medicine, Americanized medicine, typically is reactionary. We wait until there's symptoms before we treat anything. What the main benefit of these hereditary cancer screenings are is it allows us to catch cancer before there's symptoms, so that we can catch it in stage 1 or 2 instead of waiting till 3 or 4, which is typically where American medicine treats cancer. So that is the benefit. So you have the benefit to the patient, and you have the benefit to the family of the patient. So that's really critical that you get that in your heart and get that in your mind. And when you're talking to people, understand that typically cancer, if you're talking about cancer, there's fear associated with it. So if the prize is big enough, in other words, saving your life or saving your family's life, if the prize is big enough, then they'll take the risk of finding this information. This information, again, is not a cancer test determining whether a person has cancer. It's a screening to determine if the genetic makeup, the 39 genes that we screen, are predisposed to cancer. That's the benefit.